welcome to my channel. This is Shannon with SHannon. And welcome to my Midnight series. If you're new, please join us. Today is Monday Medicine. Yes, Monday Medicine. I am so sorry that I'm getting this out to you late, guys. I overslept. And you know, I like to film at the time where I'm supposed to film. So let me fix this. Okay. Kind of center myself a little bit here. Okay. Well, today we are going to be talking about opioids. Yes, opioids. But I'm not going to go into the different opioids. We're just going to talk about why we take them and the side effects. I did get my information from the CDC. As you can see, everything is from the CDC and what I know offhand. Okay, yes. I've been, what do you call it? I've been on opioids before. I have many surgeries in the past. And I love opioids, guys. I really am. I'm going to be the first one to admit I am, when I do have Norco, I do tend to get addicted. It's a very addictive drug. And for me, my drug of choice was heroin, and Norco is like a synthetic heroin. So I get that little high. So I try to steer away from them. But when I say, like, when I am in pain, they do work. But I tend to overdo it. That's just my thing. That's why I try to stay away from them. But let's see what this says. It says prescription opioids can be used to help relieve moderate to severe pain and are often prescribed following a surgery or injury, or for certain health conditions. Now, I usually get opioids, usually after you get surgery, they won't give you like the Norco. They usually prescribe Norco, which is hydrocodone in generic form. That's usually the main one, or like ibuprofen 800, but usually after surgery, you do get Norco. But my doctor is very funny about giving me Norco because, with my pneumonia, I'm sorry guys, I just woke up. It's like 1:30 in the morning. I'm sorry that this is so late. Y'all know how I roll. I keep this out at midnight, but I'm going to start filming earlier because I like to get it out fresh when I first wake, at midnight. So I'm a little late today because I slept a little long. But yeah, so my doctor will not give me an opioid. I don't care. She finally did because of my chest, because of the pneumonia. She only gave me 7 days worth, which was 14 pills twice a day. And I'm out of them already. Yeah, she gave them to me on Wednesday and they're gone. So that tells you how addicting opioids are. This was Norco. I kind of was popping 3 a day. And I like the way it made me feel. It made me hyper. I'm not glorifying the drug, but they are very, very addicting. You usually always get them after surgery because ibuprofen 800 is not strong enough for the pain. But I found that Doradol is a good pain relief. It's not a narcotic, but it's really good, and that's what I take for my chest pain. So yeah. Okay, let's read what they said. These medications can be an important part of treatment, but also come with serious risks. It is important to work with your healthcare provider to make sure you are getting the safest, most effective care. Now the risks are, okay, there are a lot of risks. Okay, risks are physical dependence, meaning you have symptoms of withdrawal when a medication is stopped. Constipation, which everybody hates constipation, but I guess this medicine gives you constipation. I hate that when I can't go to the bathroom. Very aggravating. Y'all know what I'm talking about. Increased sensitivity to pain. I don't know what that means. Maybe you do get sensitive when you're in pain, because I've noticed, like, since I've stopped the Norco, I do feel the pain a little more. Tolerance, meaning you might need to take more of a medication for the same pain relief. Yeah, I noticed that too, like, when I would take the one Norco, like, it would make me hyper and stuff, and my pain would still be there, and I wanted another one, so I pop another one. One day I popped 3, and I couldn't even keep my eyes open. I was like, and my friend was like, Shannon, you alright? And I'm like, I guess, and I just had to go to sleep just to get rid of that high because it scared the hell out of me, And then it causes nausea, vomiting, and dry mouth. I never had none of them. I guess that's what it causes. I hate dry mouth. It feels like you can't swallow. Everybody hates nausea, where you feel real nauseous, and nobody wants to vomit. Okay, sleepiness and dizziness. Yes, I do. After the high comes on, I do get tired. I've never gotten dizzy, but I've been dizzy in my life before. And then confusion goes with dizziness, so you do probably get confused from this medication. It could cause depression, which sucks for me because I'm bipolar and I don't need to be depressed anymore. And then it says low levels of testosterone that can result in lower sex drive, energy, and strength. So testosterone is really big with men, and nobody wants their testosterone lowered. Itching and sweaty. Now, itching. When you on heroin, you itch a lot. That's how you know when somebody's on drugs. It's a big sign of heroin use. They itch. You think they got bed bugs, you know what I'm saying? So it's like, I guess this might have an agent in it that also is in heroin, because heroin causes itching too. And sweating, I never had a sweating problem, but when I was on heroin, I used to itch. So opioids and heroin, I might have a little bit inside there. Okay, an opioid overdose often mark. Okay, prescription opioids carry serious side effects, serious risk of addiction and overdose, especially with prolonged use. So you're really not supposed to be on like an opioid for a long time. They're really like a short period, like after you have your surgery, just so you recover. But an opioid overdose can reduce to cause sudden death. Okay, and now it says right here, I'm gonna read that as many as 1 to 4 people. As many as 1 to 4 people receiving prescription opioids long-term in a primary care setting struggle with addiction. Endings from one story. So yeah, 1 in 4 people on opioids do have another addiction, which is a drug addiction or any kind of addiction. Okay, risks for getting opioid disorder are a history of drug misuse, substance use disorder or overdose, mental health conditions such as depression or anxiety, sleep apnea, older age 65 or older patients, and pregnancy. Wow, pregnant people got the risk? Wow. I didn't know that. Oh, wait a minute. No, for the side effects it is. Risk for getting the side effects are all these. For someone who's going to misuse drugs, of course it's going to misuse on an opiate. Because they get that ultimate high. Okay, and it says avoid alcohol while taking prescription opioids. You never want to drink when you're taking any kind of medicine because it messes up the effect. Like my bipolar meds, I can't drink. Believe me, I want to have that drink, but I can't have that drink because it's going to mess up the effects of the medicine. Okay. Also, unless specifically advised by your healthcare provider, medication to avoid includes. Now, when you're on an opioid, you're supposed to avoid benzodiazepines such as Xanax or Valium. We talked about that the other day, which I didn't know about this because this is new to me. Because I was on Norco and my Klonopin, so I did not know I was supposed to avoid. Muscle relaxants such as Soma or Flexerol. I also was on Flexerol with the, SHannon. Hypnotics such as Ambien or Lunesta or other prescription opioids. So I was mixing the Norco with the Xanny. Not with the Xanny, with the Klonopin and with the Flexerol. I did not know you can't mix that. Oh, thank God nothing happened to me. But yeah, so you guys just remember before I get some hate comments, I am not a doctor. I do have my license in social work. I am not a doctor at all. I'm not trying to be a doctor. I'm just trying to show you what I learned, and just because it's called Monday Medicine, so I figure, help y'all out because some people really don't know. Okay, now it's saying to know your options. Talk to your doctor about ways to manage your pain that doesn't involve prescription opioids. Some of these options may actually work better and have fewer risks and side effects. Options may include, okay, here's the options you could use instead of using opioids. Where are we at? 8 minutes. Okay, we're good. Pain relievers such as acetaminophen, which is Tylenol, ibuprofen, and naproxen. Some medications that are also used for depression or seizures. Physical therapy and exercise, and CBT, which is cognitive behavioral therapy. I'm in CBT right now. I do have ibuprofen 800. I like that for the stomach pain and my back pain. I like Tylenol for my headaches. For me, like with my chest, I feel like ibuprofen works better, but ibuprofen is a blood thinner. So you gotta watch out taking too much ibuprofen because it is a blood thinner. But it is also an anti-inflammatory medicine, so it helps you with your your muscles get inflamed. So I like ibuprofen 800 a lot. I love Tylenol for my head. It really works. And when I'm really tired, Tylenol PM is the way to go. I'm telling y'all, Tylenol PM if you're tired. Okay, if you are prescribed opioids for pain, never take opioids in greater amounts or more than prescribed. So, don't be like me where you're popping too. Come on. Follow up with your primary health care provider within blank amount of days. Work together to create a plan on how to manage your pain. Talk about ways to help manage your pain that does not involve prescription opioids. Talk about any or all concerns and side effects. So always consult your doctor. If you feel something's wrong or you feel like you're getting an addiction and you want something less but you do want to manage your pain, always talk to your doctor. They do have other ways to help you. Help prevent misuse and abuse. Never sell or share your prescription opioids. Now, guys, it's a big thing out where I'm at. People sell their pills, $7, $8 a pill, pop. I'm telling you to get it. So that's never good to sell them. You never should sell drugs anyway. Y'all know they ain't stupid. We're all adults here. And it's to store prescription opioids in a secure place and out of reach of others. So make sure your opioids are put up high so your little children don't get in them, or even your pets. Your pets can get into them, and God forbid something can happen to your pets. Safely dispose of all unused prescription opioids. Now I know at my police station you can bring your old bottles and your old pills of medicine, and they have like a round dispensary where you can throw your stuff in the dispensary. So maybe in your area they have something like that. It's saying they have a drug take back program or your pharmacy mail back program, or look up the FDA.org to follow the guidelines of how we can throw them away. To learn more about the risks of opioid abuse and overdose, contact www.cdc.gov/drugoverdose.com. If you or anybody believe that you are struggling with addiction, if you feel like you can't handle it or you know somebody who's really struggling, there's an 800 number they can call. It's SAMHSA National Helpline. It's 1-800-662-HELP, H-E-L-P. So that's it for today for the opioid information and how to take care of yourself. It's very hard when you take opioids because they are very, very addicting. Believe it, take it from me. But yeah, I hope y'all like this Monday medicine, and I'm sorry I put it out too late. This is the second day in a row my midnight series came out late. But yeah. Who no, I'm crazy. But yeah, I got a Dollar Tree call coming up for you this morning. I'll probably post it about 8 o'clock this morning. I'm going to film it next, so I'm going to be in the same shirt. So yeah, y'all know what I'm saying. Tomorrow is Terror Tuesday, and we will be talking about the infamous butcher of Plainfield, Eddie Gein. Yes, I call him Eddie Gein, but his name is Ed Gein. We will talk about him. So if you like the content of my channel, and you listened for this long, please hit that like button, comment, and subscribe, and you will notified every time I update on my next video. I just want to tell you all, thank you for watching my midnight series. Have a good night. Stay blessed. Get some sleep, because I know when I'm done filming, I'm taking my butt right back to sleep. All right, I love you all. Stay blessed, stay beautiful, stay safe, and once of all, the best part is, stay savvy. Till my next video. Love y'all. Bye.